Good day, everyone. My name is Samuel Okechukwu, and I'm a doctor of nursing practice, DMP student with a profound interest in mental health care, particularly in enhancing the quality of life for older adults. The topic of this project is the implementation of the GDS 15 depression scale in an outpatient clinic. Here are my community members. Through my professional experiences, I have witnessed the significant impact undiagnosed and untreated depression can have not only on individuals but also on families and communities. My passion for improving patient outcomes, especially amongst vulnerable population, has driven the focus of my DMP project. The purpose of this project is to address a critical public health issue, depression. In the United States, research has shown an increase in the prevalence of depression, with nearly 8.6% of population affected in 2019. Alarmingly, two-thirds of these cases remain undiagnosed and untreated, leading to poor quality of life and increased healthcare burden. The project specifically aims to improve depression screening and early identification among older adult patients by implementing the Geriatric Depression Scale, which also known as the GDS 15, in a clinical setting. I'm excited to explore how this project can create lasting change and improve lives in our community. The problem of undiagnosed depression in older adults highlights the urgent need for systemic screening. Depression is often mistaken for a natural response to aging, but it specifically and significantly impacts mental health and physical health. Through my professional work, I have seen firsthand how difficult it can be to identify depression in older people, which frequently results in postponing treatment and having adverse outcomes. The GDS 15 provides a streamlined, accessible approach for identifying depression in older adults. This self report tool is easy to administer, making it ideal for clinical use. Studies such as the U model highlights the effectiveness of routine depression screening, showing a 30% increase in case identification with GDS 15. Implementing this tool is essential for improving diagnostic accuracy and patients' outcomes. This is a quality improvement project aims to introduce the GDS 15 as a standard screening tool for depression in older adults. The primary goal is to improve early identification, enabling timely intervention and better outcomes. Beyond implementation, this project evaluates the tool's practicality and effectiveness, measuring its impact on detection rates and overall satisfaction among patients and providers. The findings will inform protocols for addressing depression holistically, ensuring patients receive appropriate interventions. This tool aligns with broader healthcare goals of improving healthcare through evidence based practices. Depression is a prevalent mental health issue affecting individuals of all ages, with older adults being particularly vulnerable. Globally, over 264 million people experience depression, making it the leading cause of disability. In older adults, depression is often underdiagnosed due to factors like stigma, misconception that depression is a natural part of aging, and overlapping physical health issues. Life transitions such as retirement or loss of loved ones can further increase the risk of depression in this population. Nearly 20% of individuals aged 65 and older report depressive symptoms, highlighting the need for targeted intervention. The Geriatric Depression Scale addresses this need by offering a validated, brief, and easy to administer tool for screening depression in older adults. Studies have shown its high sensitivity and specificity, making it a reliable option for routine use in clinical settings. By incorporating this tool into practice, healthcare professionals can facilitate early identification of depression, enabling timely and effective intervention. Furthermore, integrating the GDS-15 into electronic medical records, the EMRs, supports streamlined data collection and monitoring, ensuring consistent follow-up care. Ultimately, this project aims to address significant gaps in mental health screening and improve the quality of care for older adults. Implementing the GDS-15 offers significant benefits across nursing practice, advanced practice roles, and also the broader healthcare system. For nursing, it provides an evidence-based approach to early detection, aligning with corpus patterns of knowing by combining empirical knowledge and also ethical and aesthetic consideration. Advanced practice nurses can leverage the tool for accurate diagnostics, streamlined workflows, and timely referrals, promoting patient-centered care. Healthcare systems benefit from reduced costs associated with untreated depression, improved patient satisfaction, and enhanced quality of care. The project advocates for normalizing mental health screening, breaking stigmas, and fostering a more inclusive, patient-focused healthcare environment. The search strategy for relevant literature was designed to retrieve studies focused on the GDS-15 as a depression screening tool for older adults. We used well-regarded credible databases such as PubMed, PsycInfo, SynHall, and Cochrane Library. Search terms included the older adults, depression, GDS-15 depression scale, routine screening, and assessment, combined using Boolean operators for more precise results. The initial search yielded over 3,000 articles. Filters were applied to refine results, narrowing these articles to those published within the last 10 years to ensure relevance and timeliness. A language filter was also applied to include only English language articles. After the final refinement, 187 articles were retrieved. Following this, we scanned references lists to ensure comprehensive coverage and eliminated secondary sources such as clinical guidelines and opinion pieces. The final selection for review was based on primary research studies that provided empirical evidence, resulting in 10 articles that directly contributed to understanding the GDS-15's impact in clinical practice. The GDS-15 has shown to be a reliable and valid screening tool across various studies assessing depression in older adults. Several studies, including those by Acosta and Josto, demonstrated strong evidence for GDS-15's effectiveness in diagnosing depression in this population. Its sensitivity and specificity in detecting depression have been found to be high, with values often exceeding 90%. Cross-cultural validation studies has also supported its use, ensuring its applicability to diverse population, including older adults in Mexico, Brazil, and Spain. Compared to other common tools such as the PHQ-9, the GDS-15 has been shown to have similar or better diagnostic accuracy, especially when implemented in primary care settings. A study by Umoto found that routine use of the GDS-15 increased depression detection rates significantly in older adults, underscoring the importance of integrating this tool into clinical practice for early identification of depression and timely intervention. The GDS-15 plays a pivotal role in improving patient outcomes by facilitating early diagnosis and timely referral to mental health professionals. An article by Doe found that early detection of depression through GDS-15 leads to quicker referrals, resulting in better management of depression in elderly patients. The tailored treatment plans developed after early diagnosis improve the efficacy of interventions as shown by Shin. Moreover, Jeong emphasized that GDS-15's timely identification of depression can help reduce suicide risk in elderly individuals, which is a major concern given that depression is a significant factor in the high suicide rates among older adults. Additionally, GDS-15's ability to collect data helps healthcare providers track trends and make data-driven decisions regarding care. Routine screening also engage families as shown by Kumar, enhancing adherence to treatment plans. Umoto highlighted the importance of data-driven holistic approach to care, which is made possible by using GDS-15. This leads to improved patient engagement, better communication, and ultimately enhanced treatment outcomes. The strength of this literature on the GDS-15 scale demonstrates its potential as an effective tool for diagnosing depression, especially among older adults. The cross-cultural validity of the tool tested in countries like the US, Korea, Brazil, and Mexico emphasizes its broad applicability. The studies included in the review use robust methodologies such as large sample sizes and psychometric evaluations, which increase the credibility of the results. Most of these studies were observational and cross-sectional, providing key insights that can be expanded upon in future research. Positive outcomes consistently highlight GDS-15's effectiveness in identifying depression, even in individuals with cognitive impairments. This tool's reliability in identifying depression among older adults with cognitive decline makes it crucial for early intervention. Furthermore, studies conducted in diverse cultural settings have validated the tool's use across different populations, enhancing its cultural sensitivity. Despite the strengths of the studies reviewed, there are notable weaknesses and limitations that need to be addressed in future research. One of the primary limitations is the lack of long-term data, with most studies focus on short-term outcomes and not evaluating the sustained effectiveness of the GDS-15 in clinical settings. Additionally, few studies have compared the GDS-15 to other depression screening tools, limiting a more comprehensive understanding of its comparative strengths. The predominance of the cross-sectional designs in these studies restrict the ability to establish causal relationships. Another limitation is the small sample sizes in some studies, which reduces the validity and generalizability of the results. Most of the research has geographically specific, which limits the general applicability of the findings to other regions or diverse populations. Furthermore, some studies experience low response rates, introducing potential bias, and certain demographic groups, such as those from varied socioeconomic backgrounds, were underrepresented. These gaps suggest the need for further studies with more robust designs and diverse population to fully assess the effectiveness and applicability of the GDS-15 tool. The terminology used in this paper may be unfamiliar to some readers. Therefore, the following definitions are provided to promote understanding. Depression screening tools. These are standardized instruments like the GDS-15 used to assess depression symptoms in individuals. They typically consist of questionnaires with various items measuring mood, cognitive, and physical symptoms associated with depression. Late life depression, LLD, depression occurring in individuals typically age 60 and above or above. It represents unique challenges in the diagnosis and treatment due to comorbidities, cognitive decline, and social factors. GDS-15, which is also known as the Geriatric Depression Scale, is a widely used self-reported assessment designed to identify depression in the elderly. The 15-item version aims to screen for depressive symptoms. Depression is a common and serious medical illness that negatively affects how you feel, the way you think, and also the way you act. The theoretical model, the TTM, is essential for guiding the implementation of the GDS-15 depression scale in routine clinical practice. The TTM breaks down the process of behavioral change into 6 stages: pre-contemplation, contemplation, preparation, action, maintenance, and termination. In the pre-contemplation stage, older adults and stakeholders may not see the need for routine depression screening, making awareness and education efforts crucial. In the contemplation stage, individuals may recognize the benefits of screening but remain hesitant due to concerns or lack of understanding about the process. The preparation stage marks the point where individuals are ready to act, and also this involves preparing both healthcare professionals and also older adults to integrate the GDS-15 into their routine visits. The action stage is when the older adults begin engaging in the screening, which must be conducted smoothly and confidentially to engage participation. In the maintenance stage, ongoing support and follow-up care are necessary to ensure continuity and prevention of relapse. Finally, the termination stage reflects the successful incorporation of the routine screening into regular healthcare visits, ensuring long-term mental health awareness and intervention for older adults. A retrospective approach is chosen to assess the impact of the GDS-15 on depression detection rates in elderly patients. This method allows for data comparison before and after the intervention while minimizing disruptions in clinical practice. The data will be gathered from electronic medical records at a clinic in the northeastern part of the United States. A total of 102 participants will be selected, split evenly between the pre- and the post-intervention groups. The inclusion criteria focuses on patients aged 60 and older with no pre-existing major depressive disorder or documentation of the GDS-15 administration in the post-intervention period. The exclusion criteria eliminates participants who don't meet the specifications. Once the data is collected, each record will be de-identified by the privacy and confidentiality, ensuring that patients' identities are protected. This approach ensures the study is both cost-effective and efficient while also maintaining the integrity and security of patient data. A structured data collection sheet will be used to extract data from the EMRs. The data gathered will include demographic information, GDS-15 depression scores, depression symptoms, and also any intervention initiated based on screening and whether providers were notified. The data will be de-identified to ensure that patients identified as kept confidential, complying with HIPAA regulation. The statistical analysis will involve an independent sample t-test to compare the mean depression symptoms between the pre- and the post-intervention groups. This method is appropriate as it will allow us to assess if the GDS-15 tool effectively improves depression rates. SPSS software will be employed to perform the statistical analysis, ensuring that The results are both reliable and also accurate. The analysis will help to determine the impact of the intervention on improving depression recognition and treatment initiation among elderly patients. By using both ordinal and nominal data types, this study will assess both the severity of depression on as well as the types of intervention that were initiated, provided a comprehensive evaluation of GDS-15's effectiveness. Key resources required include access to the clinic's EMR system, data collection tools, personnel for analysis, and necessary office equipment such as computers and stationery. The estimated total project budget is $1,796.95, with expenses distributed across various categories such as printing costs for the GDS-15, travel expenses, laptop purchase, and also necessary software that was going to be used. The project will be completed within a 6-month period. Ethical considerations are paramount, and the study will adhere to institutional guidelines and regulation. The project will secure IRB approval and also ensure that all data is de-identified for privacy. The study will also comply with HIPAA regulations to protect patient confidentiality. These measures are essential to maintain ethical standards while ensuring the research findings are valid and meaningful. First, the purpose of the evaluation is to determine the success of integrating the GDS-15 tool in clinical practice by comparing outcomes before and after the intervention. This involves collecting data from the EMR, focusing on relevant variables such as the GDS-15 scores, identified symptoms, and also intervention initiated. The analysis will use SPSS software ensuring accuracy and statistical rigor. We will apply independent Stemples t-tests to assess the significance of the differences in depression detection rates before and after the GDS-15 implementation. To clearly communicate the findings, the data will be presented visually using charts and graphs, which will highlight the effectiveness of the intervention. Outcome measures like the number of symptoms identified and provided responses will be centered to evaluating the project's success. Finally, the results will be documented and presented to stakeholders, forming the basis for future improvement in depression screening. The aim is to ensure that the implementation of GDS-15 leads to more accurate and timely depression detection, benefiting the elderly population. The result of implementing the GDS-15 in an outpatient clinic reveals significant improvements in depression screening and care. This project was conducted in a clinic serving a vulnerable population, including elderly individuals with multiple coexisting health conditions. Prior to the intervention, informal and inconsistent screening practices left many cases of depression undiagnosed, affecting patient outcomes and also increasing healthcare costs. The introduction of the GDS-15 addressed these issues by providing a structured, sensitive tool for early detection, which resulted in a noticeable increase in screening rates from 36.4% to 67.5%. This improvement not only enhanced diagnostic accuracy but also reduced the time needed to diagnose depression, with a marked decrease in wait times for diagnosis from 8 to 3 weeks. Additionally, patients who screened positive for depression had a higher rate of receiving timely mental health service, increasing from 15% to 40%. This tool, designed for elderly populations, demonstrated excellent sensitivity and specificity, and its use led to faster diagnosis and improved follow-up care for patients. The significant Z-test and confidence intervals suggest a meaningful difference between the proportions before and after intervention. This difference is statistically significant as the t-test statistics far exceeds the critical value. The studies demonstrated a significant improvement in depression detection rates among elderly patients, increasing from 36.4% to 67.5% after implementation of the tool. This aligns with existing evidence suggesting that GDS-15 is highly sensitive and specific for identifying depression in older adults. The tool's simple yes or no design made it quick to administer during routine visits, minimizing disruptions to clinical workflow. Clinician training further supported the tool's successful application by ensuring consistency and reducing variability among administrators. One of the project's major strengths was the retrospective chart review, which minimized bias by using real patient records without interfering with care delivery. Additionally, the structured training sessions boosted clinician confidence and also increased patient acceptance of the tool. However, limitations included selection bias on only patients attending routine appointments were screened, potentially excluding high-risk population. Documentation inconsistencies before implementation affected baseline data accuracy, and time constraints during peak hours created challenges for comprehensive screening. Despite these obstacles, the GDS-15 demonstrated a significant promise as an efficient and effective tool for improving depression rates in elderly patients. Future efforts should address this limitation to enhance the tool's impact further. The project highlights the GDS-15 is a simple yet effective tool for early detection of depression in elderly patients. To maximize its impact, it is recommended that the tool be implemented as part of routine mental health screening in both outpatient and early care settings. Expanding studies to other clinical environments will help validate its effectiveness across diverse populations. For sustainability, regular staff training sessions are critical to maintaining consistent and effective use of the tool. These sessions should target both new hires and long-serving clinicians to ensure alignment with updated workflows and best practices. Periodic audits of patient records will provide ongoing feedback on the tool's performance and inform necessary adjustments. Collaborations with other clinics and also hospitals can promote resource sharing and standardization of mental health screening practices. Dissemination efforts will focus on both internal and external channels. Internally, presenting the project's outcome to clinical stakeholders will encourage broader adoption. Externally, publishing findings in nursing and geriatric care journals and presenting at conferences will raise awareness among healthcare professionals. Additionally, training community health workers can extend the GDS-15's reach to understand population, enhancing its broader public health impact. Here are my references, and thank you for listening.